Is prevalence in dental in Saudi children. We have a systemic review that make the case prevalence in Saudi Arabia was high with the mean DFT 4.5 for children and 3.5 for adult population with the percentage between 60 and 80. That means that the WHO goals doesn't admit for the Saudi Arabian children. It's important to find a new preventive measure for caries prevention in Saudi Arabian children. Concerning caries, few randomized clinical trial evaluate the mouth lenses and the natural product as a caries preventive measure. Our study will attempt to find the effect of single-use 3 different mouth lenses on the level of Streptococcus mutant saliva on children between 8 and 10 years old. The null hypothesis will be there is no difference and there is no positive effect in the effect of the tested mouth lenses on the level of Streptococcus mutans and between 8 and 10 years old children. Predictor will be mouth lenses, the outcome will be salivary Streptococcus mutans. Material method.
Hello, my name is Sultan. Inclusion criteria in our study it will be 80 Saudi children, healthy, with positive or potentially positive behavior, not under active orthodontic treatment, children adhering to at least once daily brushing routine without other oral hygiene measures, and children with DMFS above 4, not using any medication or having active periodontal disease. For exclusion criteria, children with medical history of a systemic disease that will compromise the conducted study, history of current usage of antibiotic or mouth lenses, history of less than 1 week of application of fluoride, and any condition that require emergency dental treatment like abscess and cellulitis. Our investigation products is for mouth lenses, including the distilled water as a baseline or control group. We have the Listerine Miswak and Avalon Abo-Hex mouthwash and Optima Allodent mouthwash. Ethical approval, we have the IRB approval, CDRC approval, and DOH clinical study approval. The investigator have the certificate of a good clinical practice course, and also certificate and bioethics certificates. Comment and material with my colleague Ibrahim.
For the material for clinical examination, we have it's divided to 2 sets. So one for the examination, like the disposable diagnostic kit, and mouth lens cup for the data collection or to take the specimen. We have the sterile container and the mouth lens. Material in the micro lab divided to 2 sets also, one for sample dilution and one for the blood agar preparation. For intra-examiner reproducibility of the investigator to test the reliability, we have 2 indexes, one for the caries assessment, which is the DMFS according to WHO 2013, and the DIS score for oral hygiene.
Okay, for the sample calculation, the statistician will use OpenEY software for the sample calculation with the formula shown in the slide. As we said, we have 80 Saudi children as a sample size. The age group from 8 to 10 that will be calculated. Randomization will be done. Children will be distributed for the four mouth lenses group, including the distilled water as a control group. We will use allocation concealment to prevent the participant from knowing in advance which group of mouth lenses he will be a part of. Blindness will be used also. A different individual in this study will have the missions of experiment or collecting the saliva. So to create an unbiased environment, research environment, the individual who will perform the microbiology analysis, he will not know which mouth rinses will be used. We have our color code and number coding of the mouth rinses, which will be blind for the microbiologist. And this is the microbiologist numbering, no one by us. Clinical phase.
In the clinical phase, each child will be asked to rinse with water, 10 milliliter of water for 30 seconds. Then, after 2 minutes, we'll collect the saliva sample. This is for the baseline count for Streptococcus mutans. The second step is to ask the child to rinse with the assigned mouthwash for 2 minutes. Then we'll do the same thing, but we'll collect after 15 minutes. Here some lab steps like mixing the to do the agar agar plates. We'll mix agar base with saccharose, then with blood autoclaved in 121 degrees for 1 hour. In the lab phase, we'll do the serial dilution technique. We will have 10 tubes marked 1 to 10. Each tube has sodium chloride 0.9% and also 4.5 ml. The first tube will add the saliva, 0.5 ml of the saliva. Then we'll repeat the step over again until we reach the wanted dilution.
Okay.
Last thing, we'll spread the specimen on the blood agar, and it will be incubated in body temperature for 24 hours.
Okay. Budgeting, our total cost of our study 20,900 riyals, including the microbiology material and the clinical material and the other materials. Alhamdulillah, we have an agreement with Warif Charity, which is a charity center that follow King Faisal Specialist Hospital and Research Center to fund the research. This is our time schedule. We are in the October month. We are in data collection. We will start in January the data analysis. The statistician will use the SPSS software for statistical analysis, and that's it.
Very nice, very well written, very well designed. I only have one question about the age range. You said you need 80 children.
80.
Yes. And the age range is 8 to 10. Why did you choose 8 to 10 specifically?
Because this age group we can it's usually this age of a group has a definitive positive or positively behavior.
But I think you will face difficulty in getting 80 participants with these inclusion criteria and 8 to 10. So why not including, let's say, 7 to 12?
We in this problem we are in amending process for doing this study to include 2 locations on the study, 2 elementary schools. We received the acceptance from the 2 schools. Tomorrow we will sign the agreement between us and the hospital.
If you are going to go to school, then yes, but if you are depending on the patients
No.
at the hospital.
No, we will solve this problem.
Inshallah.